Hello to the visually gifted and welcome to Microbiology. You're watching Haemophilis Ducreyi. So we're going to remember Haemophilis Ducreyi as vampires do cry. Why vampires? Because they love blood. Phil, of course, means blood, hemo, or love, and or have a strong liking for, and hemo, of course, means blood. Here you see a vampire. He's got a I Love Blood t-shirt on. And part of the reason I have him with an I Love Blood t-shirt is not just, uh, you would think that the vampire might suffice, but if you see the Haemophilis influenzae video, they also have this t-shirt. So that's just to remind you, it's a Haemophilis genus. So you also see a can, you see some shrimp on the stairs. Of course, he is crying. He is, and that's okay. You can cry. It's hard being a vampire. So, Haemophilis do cry. The can represents a canker that's an exudating canker caused by Haemophilis do cry. The shrimp on the stairs is a reminder of the booba, or why booba? Because of bubble gump shrimp. So shrimp is our visual association for boobas, and a boba is basically a swollen or inflamed lymph node, especially in the armpit or groin area, where there are superficial lymph nodes that this can be easily observed in. One other thing is, with this I Love Blood shirt, remember this is a Haemophilis genus, so other things that apply to the Haemophilis genus is also going to apply here, such as gram-negative staining, growth on chocolate agar, making them a fastidious genus, and being Coccobacillus in morphology. So if you're having a hard time remembering these things, you're going to want to see the Haemophilis influenza drawing to make those easy associations. But yeah, it's pretty quick here, so let's just do a question, wrap it up. So you have a gram-negative bacteria that is needle aspirated from an inflamed lymph node in the inguinal region of a 24-year-old male who recently returned from a vacation in South America. The patient also has a painful canker with an exudate, let's say an inguinal canker, with an exudate. What medium do you differentially expect the gram-negative bacteria to be cultured on? And why differentially? Because you can't be totally sure, of course, but you might suggest a medium that this could be cultured on. So how do we make these associations? Again, some of this is gonna go back to the Haemophilis influenza drawing, but it is grown on chocolate agar. So you can suggest, in light of the fact that it's gram-negative, they're showing the bulbous, the canker with the exudate. It's a good reason to believe this could be Haemophilis Ducreyi. So it could be grown on chocolate agar, and you can remember this again through Haemophilis influenza drawing. But remember, the chocolate agar actually has no chocolate. I said it has no agar, it has no chocolate. Which is kind of funny, but some people might think it would have chocolate. But the reason why it's called chocolate is because the blood, essentially, once it's lysed, which is what chocolate agar is made of, it's made of lysed red blood cells, it looks like chocolatey brown. So it looks like, basically, it has the color of dried blood, brown. Haemophilis is blood lover. That's another way to remember that it's, so if you remember that Haemophilis is a blood lover, and you remember that, sorry, I just got a call, and you remember that chocolate agar is made from lysing red blood cells, you're going to know that this is a chocolate agar species. And that's all I have for you guys right now. Thanks for tuning in. This is Microbiology.